A stress test is a test that we use in cardiology to check the blood flow in the arteries around the heart. The heart is an organ that pumps blood to the rest of the body, but since it's an organ just like the kidney, pancreas, or spleen, it needs its own blood supply. And the heart is supplied with blood through three main blood vessels called coronary arteries. There's one on the front, one on the left side, and one on the right side. If these arteries get stopped up, then the heart doesn't function correctly. So we use a stress test to get an idea of the blood flow through the heart. And there's two ways we do a stress test. One is with exercise, and the other is with a pharmacological approach or a chemical stress test. With exercise, we put a patient on the treadmill, we hook them up to an EKG, and we walk them. If there's decreased blood flow in the heart, it changes the electrical system of the heart in that area, and it shows up on the EKG as a problem. We can also inject a radioactive isotope into the patient, and it allows us to look at blood flow in the heart during exercise. If there's a problem with flow, that is to say if the patient has a blockage or a narrowing of the artery, then there's decreased flow in the scan, and that gives us an idea of how good or bad the heart arteries are doing. The other approach is a pharmacological or chemical approach. This allows us to treat patients that are not able to exercise. For example, if they have knee problems, back problems, or whatever. What we do is we give them a chemical which simulates exercise and allows us to look at blood flow to the heart to see if there's any narrowing in the blood vessels around the heart.